Good afternoon, everybody, and welcome to the webinar. This afternoon, we're going to be talking about self-harm and non-suicidal self-injury. For those of you who are not familiar with this is the webinar for you. And for those of you who just want to learn more about it, this is also for you. We're going to go over some of the basic definitions, basic criteria, also some of the signs and symptoms, and ways to help. So I hope you enjoy. So you might be wondering, what is self-harm? As some of you might know, self-harm is cutting yourself, injuring yourself. It's a psychological condition. People intentionally harm themselves, but it's not in a suicidal attempt or a suicidal ideation. So usually people are not intending to end their life. It's not something they're trying to do to get out of a situation. It's just a coping mechanism that people develop. As of right now, it's not actually seen as an individual diagnosis. Some people are trying to get it into the DSM, which is the Diagnostic Statistical Manual. It's something that a lot of mental health professionals use to help them diagnose patients and figure out criteria. But as of right now, it's actually something that's seen under borderline personality disorder. But it's not diagnosed in itself as a single diagnosis. It's usually diagnosed under something else. But that's a side note. That's not very important. That's just about mental health jargon. But anyways, self-harm is just basically where people intentionally hurt themselves as a way of coping. People will often cut places that can easily be hidden by clothing, so either their arms or their legs. Sometimes they'll cut their chest or their stomach, someplace that they can hide by wearing long pants or long sleeves. So that's one place that they'll usually cut. But as I said, it's not something that's usually a suicidal intention. People can sometimes unintentionally cut two teeth and need emergency care, but typically they just cut just a very slight level that it's just enough to see it bleed and feel pain, but not actually injure themselves enough to cause death or bodily harm. Understanding self-harm. I found this quote in a book I was reading, and at the end I'm going to list the book because I think it's an excellent book. It does a great job of discussing the different kinds of cutters, the different reasons people cut, and also understanding the psychology behind it. But this is a book that somebody suggested to me, and I loved it. But this quote is from one of the clients that this guy had, and she was explaining why she cut. And as you can see, it says, "Because I controlled the pain, there was no fear in it." So as I said before, self-harm is often seen as a coping mechanism, and so people will use it when they're unable to cope with some situation, feelings, or a combination of both in a way that they understand. So the way that they feel best is when they cut themselves, because there's a couple, in this book it also discussed the different kinds of cutters that there are. We're going to touch on that briefly a little bit later, so I don't want to get into it right now. But basically, it was just talking about how people use it as a coping mechanism because it's a way that they can control the pain emotionally by causing pain physically. So I think this quote just captured it really perfectly. Self-harm can also become a compulsive behavior, and this means that the more an individual does it, the more they need to do it. So it's a very habit-forming because the brain can form a connection between the behavior and the emotional relief. Because as you know, when you get hurt, your brain will release chemicals to help you feel better, and they'll send these endorphins to your brain, and sometimes when you do this enough, the brain will create a pathway between pain and emotional relief. So this behavior can become very addicting, especially for teenagers and adolescents who have a very malleable brain to begin with. So it's just something to really keep in mind, that it's a very addictive behavior. And the longer that the behavior occurs, the stronger the connection will be. So if you at all suspect that somebody is doing this, it's very important that they seek help immediately, because they'll have a much stronger chance of having a quicker recovery. And something else to note is that people typically self-harm when they're trying to cope with intense negative feelings, either about themselves or about something that's happened to them. So there's usually a very strong psychological aspect to this that's causing the behavior to occur. So that's just something to keep in mind. So these are just some signs and symptoms. Obviously, something to note is that there's unexplained scars or scratches or wounds. And also, as I said before, that people often wear long pants and long sleeves, and they'll do this to cover up the scars or wounds that they have on their arms or legs. In Indiana, this could be seen as normal behavior, considering that 9 months out of the year is pretty much cold. But if you ever see a child who's wearing clothes that don't really match the weather for that day, so if they're wearing long pants and long sleeve shirts when it's really hot out, this could be a sign that they're trying to hide something. Withdrawal from social activities and things they used to enjoy, that's one sign, because people are often very, very ashamed of their behavior. So they'll usually try to retreat from social situations so that they can be alone and be able to participate in the behavior without being judged. And sometimes they don't know when they're going to be triggered and when they're going to feel an urge to cut, because sometimes situations can trigger the behavior and make them feel overwhelmed with emotion and then feel the strong urge and compulsion to go cut and feel some relief from the pain. Also, people who are very secretive and they seek isolation, that's something else to look for. Unexplained scars and wounds, like I said before, claiming that accidents have been caused by a pet or other things. They accidentally cut themselves while cutting an onion. They accidentally cut themselves shaving. They accidentally ran their leg into a bicycle rack, whatever it might be. They're going to try to make up excuses for the wounds that they have. General moodiness, irritability is one thing. Also, depression, if they seem like they have a depressed mood. And as I said before, intense feelings of shame and guilt is often a big thing about self-harm, because people often feel very shameful and guilty about the behavior, but yet they don't feel like they have any ability to stop it. So contributing psychological conditions, some things that sometimes are seen with self-harm behavior are things like depression, anxiety, low self-esteem, loneliness, and also things like lack of coping skills and a poor ability to cope with emotions and negative feelings. Something else maybe to note in there is possible eating disorders, which goes along with a lot of these other things like depression, anxiety, and low self-esteem, can also be seen with self-harm behaviors. But as you can see with a lot of these conditions, they often are accompanied by psychological feelings that are very negative and often cause a lot of distress, a lot of unwanted feelings that if these kids lack healthy coping skills or even support networks that they can express their feelings openly and honestly, sometimes that'll trigger them to turn towards self-harm because they don't know how else to cope with all their feelings and emotions. And it feels like it's the only way to feel any release from all the distress. High-risk groups, these are just some risk groups that are a higher rate of maybe participating in self-harm behavior. So it's just one thing to keep in mind. Anybody can do it. Anybody can get messed up with self-harm, but these are the ones that they've seen the highest rates in. So first and foremost, victims of physical and sexual abuse. Because self-harm is such a coping mechanism, people in these situations often use it as a way to deal with things that have happened to them or feelings about their past that they don't know how else to explain. And one thing to note about sexual abuse is that if it occurs early, sometimes they can get borderline personality disorder, and that's one where I was talking about earlier that self-harm is seen under borderline personality disorder and is one of the criteria for diagnosis. So that's just a side note. That's not very important to know, but I just want to throw that out there. People who have a friend who self-harm, so if there's a group of girls or a group of teens that are self-harming, I did say girls, and girls are more prevalent to get it, but it does happen in boys. I'm not exactly sure about the ratio, but girls are slightly of increased risk. But kids who have a friend who self-harm, they might do it as a group thing, or they might tell each other about it, and they can feed off each other in that way that makes them all think that this is a good coping mechanism. People have experienced a traumatic event, so maybe they were a victim of a crime, maybe they witnessed domestic violence, maybe they had something else traumatic happen to them that made them feel like they don't know how to cope with this, they don't know how to process this. So they're internalizing all of these negative feelings and they don't have a way to vent them. So they turn to self-harm as a way to get their feelings out and feel a release. People who abuse substances, that's another group, and also people who have other underlying mental health conditions, like I listed earlier. So the mood disorders like depression and anxiety, things along those lines can also be high-risk groups. So you might see, why do people cut? Like, if it's so shameful and they're so guilty about it, why do they do it? One reason is to externalize pain and therefore help themselves feel release. I've touched on this a little bit. A second reason is that people often want to show other people how much they're emotionally hurting. They might not have the words to say, I need help, I'm hurting, I don't know what to do. So instead they cut. And these are the types of people that might not try and hide it. They might wear short sleeves even though they might have a fresh wound on their leg or on their arm. So they might not try that hard to hide their wounds because they want people to see them. They want people to ask because they're looking for help. A third reason is that people are doing it as a way to punish themselves. They might feel like they're to blame for the event that happened to themselves, or that some reason they're a freak for feeling certain emotions, so they're going to try to punish themselves by cutting. And another reason is to help them cope with negative feelings. This could kind of correlate with externalize the pain, but this might be more about coping with feelings inside that they're not very content with, negative feelings about themselves. So these are just 4 reasons. They do discuss them in more detail in the book, and I'll list that book at the end. So right here is just a list of different resources that I've come across. There's thousands of resources on the web. So this is just some that kind of touch upon it and talk about it more from like the teen perspective. This YouTube video right here, where did it go? Never mind, it must be on a different slide. But I thought it was on here. But anyways, these are some great resources. And something to say about how you can help someone who is self-harmed. I just wanted to include this list because as youth providers, like we work with youth a lot, so it's important to be prepared to handle situations like this and know how to be helpful instead of harmful and how to intervene. So first and foremost, listen and don't judge. It's already a very shameful and guilty behavior. So people just want to be listened to, and they don't want to feel like you're judging. Judging is going to shut down the lines of communication. Also, ask them what they need from you. Your idea of what might be helpful may not be helpful from them. So try to get an idea of what kind of things would be helpful for them. Maybe it's just being there as a mentor. Maybe it's offering support. Maybe it's helping them tell their parents. Whatever it might be, get an idea of what they need. Also, remind them that recovery is a process and it's not perfection. We're going to fall short, we're going to fail, but it doesn't mean that we're failures. Just because we've had a flaw or we've made a mistake, that doesn't make us failures. So in the recovery process, they might go a few days and do really well and then fall back to their old behavior, but recovery is a process. Fourth, just check in with the person and see how they're doing. Make sure you keep those lines of communication open and make them know that you're there for them and that you care deeply about them. And also learn with them. A lot of people aren't really aware of self-harm or even the prevalence that it has in the adolescent community. So learn with them. Go with them to different coping mechanism networks, or try to help them find another way to externalize their feelings. Learn a new skill with them. Maybe you could both do an art project together. Whatever it might be, learn with them. We all can learn more about coping more in a healthy way with our feelings and emotions. So it's something that we all could benefit from. Okay, so here's the other resources. These are the videos I was talking about. I was noting those on the slide like 2 slides ago. But these are some videos from a channel that I had found on YouTube, and they're really great. They also have a lot of other mental health videos, so I really encourage you to go check these out if you want to learn more, or if you want more details, or even just a different perspective. I encourage you to check these out. And this is the book that I was talking about. It's called Cutting, and it's Understanding Self-Mutilation. It's by Stephen Levenkron. It's an excellent book. I really encourage you to read it. It goes into a lot more detail than I went today, and I really benefited from reading it. It really gave me a new perspective on self-harm. So I'd encourage you to read that if you ever find yourself in the situation where you're trying to help a youth through self-harm, or if you just want to learn more about it. So I thank you for listening, and I hope you've enjoyed.